Every year, millions of seniors go in for routine checkups, thinking they're doing the right thing. But what if I told you some of these very tests might actually raise your risk of stroke overnight? It sounds hard to believe, doesn't it? You trust your doctor. You follow every recommendation. But buried in the fine print of modern medicine are silent risks that no one warns you about. Not the news, not the brochures in your clinic, and sometimes not even your doctor. Imagine walking out of your annual checkup thinking everything is fine, only to experience dizziness, blurred vision, or worse, just days later. And you're left wondering, what just happened? Here's the truth. Certain diagnostic tests, especially when done too often or under certain health conditions, may quietly trigger sudden spikes in blood pressure, disrupt blood flow, and even set off a chain reaction that can end in a stroke. But don't worry. This video isn't here to scare you. It's here to inform you, so you can ask better questions, so you can protect yourself and your loved ones. Because after the age of 60, it's not just about catching problems early. It's about avoiding the ones we might accidentally cause. In the next few minutes, we'll uncover the 5 most common medical tests that may carry hidden stroke risks, especially for seniors. And more importantly, you'll learn exactly how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments. If not, drop a 0. And make sure to subscribe to Health 365, where we uncover what others won't tell you. Now, let's talk about the first test you should think twice about. Now, if you've ever had a CT scan with contrast, you might remember that warm, flushed feeling spreading through your body. That's the contrast dye doing its job, helping your doctor see your blood vessels, organs, and tissues more clearly. Sounds helpful, right? But here's what many seniors are never told. That little injection can do much more than just enhance the images. It can quietly put stress on your cardiovascular system, especially if you're over 60 and already dealing with high blood pressure, heart problems, or kidney issues. For some people, the contrast dye triggers a vasovagal reaction, a sudden drop in both heart rate and blood pressure. This can lead to dizziness, nausea, fainting, or even brief unconsciousness. But in other cases, the opposite happens. Blood pressure spikes rapidly, and fragile blood vessels can tighten or go into spasm. When that happens, the risk of a stroke or cardiac event quietly creeps in. A study in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or impaired kidney function. In short, the more vulnerable your system, the more dangerous that contrast dye could become. Let me share a real case. An 81-year-old man went in for a routine abdominal CT scan after having some minor digestive discomfort. The scan came back normal, and he was sent home feeling fine. But 2 days later, he suffered a minor stroke. The likely cause? The contrast injection may have temporarily spiked his blood pressure, causing a clot to form and block blood flow to part of his brain. This doesn't mean CT scans with contrast are bad. Far from it. They can detect cancers, blood clots, aneurysms, things that could save your life. But the key point is this: these scans should be used wisely, not just ordered as part of a routine checkup just in case. So what can you do to protect yourself? Before agreeing to a CT scan with contrast, ask your doctor, is this scan essential, or is there a safer option for someone my age and condition? Share your full history, especially if you have high blood pressure, kidney disease, heart conditions, previous reactions to contrast dye or medications, and always ask, can we do this without contrast? Sometimes a non-contrast CT or an ultrasound can provide enough detail without the added risk. Coming up next, a common screening many seniors get, even when they feel perfectly fine, that may not be as harmless as it seems. Now, let's talk about the stress test, also called the exercise stress test. On paper, it sounds like a smart move. Put on a heart monitor, walk on a treadmill, and see how your heart performs under pressure. But if you're over 60, especially with high blood pressure or heart conditions, this simple test could turn risky. Here's why. During the test, you're asked to walk or even jog on a treadmill while your heart is closely monitored. But as the speed increases, your heart rate shoots up, your blood pressure rises, and your cardiovascular system is suddenly under intense strain. For a healthy 30-year-old, this might not be a problem. But for seniors, especially those with pre-existing conditions, it can be like lighting a fire near dry brush, potentially triggering serious complications. Some of the risks: dangerous spikes in blood pressure, sudden arrhythmias, irregular heartbeats, and in rare but real cases, small tears in fragile blood vessels, especially in the brain. A 2020 study in the American Journal of Cardiology looked at over 1,300 patients above age 65 who underwent treadmill stress tests. The results? Nearly 7% experienced harmful events during the test, including blood pressure surges and abnormal heart rhythms. And the most affected group? Those who already had vascular issues. And this isn't just theory. It's real life. One of our subscribers, Margaret from Ohio, shared her story. She's 74 and has had high blood pressure for years. Her doctor recommended a stress test, just to check in. Halfway through the treadmill portion, she began to feel dizzy and had tightness in her chest. They stopped the test immediately, but by the next day, she suffered a minor stroke. Doctors believe a sudden rise in her blood pressure during the test ruptured a tiny vessel in her brain. To be clear, the test didn't directly cause the stroke, but it introduced stress to an already vulnerable system, and that's what tipped the scale. So, what's the real takeaway? Talk to your doctor. Ask, is there a safer way to evaluate my heart? In many cases, a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram may be safer options for seniors. And if you're not currently experiencing symptoms like chest pain, shortness of breath, or fatigue, ask whether the test is truly necessary right now, or if it can wait. Coming up next, we'll explore another routine test that seems harmless, but could come with hidden risks if you're not cautious. Let's now talk about something that's become incredibly routine, especially after 60. The endoscopy. Whether it's to check your esophagus, your stomach, or even your colon, doctors often recommend it just to be safe. And sometimes that makes sense. But here's what no one tells you. If you don't really need it, and especially if it involves sedation, it might do more harm than good. For starters, most people over 60 are on some kind of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. And when you're sedated for an endoscopy, your blood pressure and circulation naturally change. Combine that with medications that affect your blood's ability to clot, and suddenly you're looking at a higher risk for internal bleeding, or worse, brain circulation problems that can trigger a silent stroke. In 2021, a large-scale review published in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy procedures, there was a significant increase in transient ischemic attacks, TIAs, also known as mini-strokes, within the following 72 hours. These weren't major strokes, but they were warning signs that something had gone wrong in the brain's blood flow. One case that stuck with me was from a 76-year-old woman who had a routine colonoscopy with sedation. She had no symptoms going in, but 2 days later, she started slurring her speech and lost coordination. The ER confirmed she had experienced a mild stroke. The doctors believed the drop in blood pressure during sedation, along with her daily aspirin use, may have created just the right conditions for a clot to travel. Even if the procedure itself is low risk, the combination of sedation, age, and medications can create a perfect storm. Now, this doesn't mean you should avoid all endoscopies, but it does mean don't agree to one unless your doctor can clearly explain why you need it right now. If you're just getting it because it's been a few years, ask if there's a safer way to monitor your condition, especially if you have no symptoms. Always remind your doctor about any medications you're on. Ask them, will I need to stop my blood thinner before this? What are the risks of sedation for someone like me? And if you're uncomfortable with sedation, ask if the procedure can be done without it, or with lighter options. Next, we're going to talk about another test that often flies under the radar, but it's one that involves something many of us never even think about: the kidneys. MRIs are powerful tools. They help doctors see deep into your body, spot early signs of trouble, and sometimes avoid unnecessary surgeries. But when a contrast dye is added, usually to get clearer images, that's when caution is needed. Especially for older adults, and especially for those with even mild kidney problems. The contrast dye used in MRIs often contains gadolinium, a heavy metal. It doesn't stay in the body. It's meant to be flushed out by your kidneys. But here's the catch. After 60, kidney function naturally slows down. And if you already have chronic kidney disease or reduced function that hasn't been diagnosed yet, your body may not eliminate the gadolinium as effectively. Over time, small amounts can linger. That lingering can be dangerous. Gadolinium retention has been linked to a rare but serious condition called nephrogenic systemic fibrosis, NSF, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can limit movement, breathing, and even lead to organ complications. But here's the part most people don't hear about. Retained gadolinium has also been found in brain tissue, and some researchers believe it may cause subtle neurological symptoms like confusion, dizziness, and disorientation, particularly in people already at risk for circulatory issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who received contrast-enhanced MRIs. Within a week of the procedure, about 5% reported stroke-like symptoms, headaches, blurred vision, balance problems. These weren't full-blown strokes, but they were red flags. Most of these patients also had underlying kidney issues, whether diagnosed or not. Harold, a 79-year-old veteran from Arizona, went in for an MRI after struggling with persistent back pain. His doctor ordered it with contrast, just to be thorough. Harold had no idea his kidneys were weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran labs that they discovered he had stage 3 kidney disease. "No one warned me," he told us. "Had I known, I would have asked more questions." So, here's what you can do. If your doctor recommends a contrast MRI, ask, "Can we do it without the contrast?" Often, the answer is yes. If contrast is truly necessary, request a kidney function test first. It's a simple blood test called a GFR, and it can give your doctor and you peace of mind. Also, let them know if you've ever had strange reactions to imaging tests in the past. Remember, the MRI itself isn't the problem. It's the extra chemical your body may not handle well. With the right precautions, you can still get the answers you need without putting your brain or kidneys at risk. Next, let's turn our attention to a test that seems harmless, even smart to do on a regular basis. But it may be steering older adults toward risky surgeries they never actually needed: the routine carotid artery ultrasound. It's non-invasive, takes just a few minutes, and doesn't involve any needles, dyes, or machines that make loud noises. Sounds like the perfect preventive test, right? But here's what most people over 60 don't know. If you don't have symptoms, and your doctor is just ordering this scan to check, this simple test might lead you down a path to surgery you never needed in the first place. The carotid arteries are the main blood vessels that deliver blood to your brain. Over time, like many vessels in the body, they can develop plaque, little buildups of cholesterol or calcium. That's normal, especially as we age. But not every bit of plaque needs to be removed. In fact, in many cases, it's safer to monitor it than to operate. Here's where things can go wrong. Let's say you get the test, and it shows some narrowing in the artery, maybe 50% or even 60%. That sounds scary, right? So your doctor refers you to a vascular surgeon, and suddenly you're being told you should consider a procedure, like a carotid endarterectomy or a stent. But if you had no symptoms, no dizziness, no vision changes, no weakness, these procedures might offer little benefit, and they carry real risks. In fact, a major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than medication and lifestyle changes. And more troubling, a small percentage of patients who underwent surgery actually experienced strokes as a direct result of the procedure, either during surgery or in recovery. One story that really hits home comes from Helen, 82, from Pennsylvania. She went in for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor just wanted to be thorough. It showed 65% narrowing. She was sent for surgery within weeks. Sadly, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us, "I wish I'd known that doing nothing might have been safer." So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for, and what happens if we find it?" Make sure you understand whether the scan is likely to change your treatment or simply cause worry. If you're already on blood pressure meds, cholesterol drugs, and living a healthy lifestyle, extra tests may not change much. And if you've already had a scan that showed some narrowing, don't panic. Ask about repeat scans instead of jumping to surgery. And always get a second opinion before undergoing any vascular procedure. Let's wrap this up with some warm advice and a gentle reminder that your health is in your hands. So here's the bottom line. Not every test is dangerous, but not every test is necessary either. Especially after 60, our bodies respond differently. What seems routine, like a contrast dye, sedative, or scan, can have ripple effects we don't always see coming. A simple injection might spike your blood pressure. A scan might trigger a reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it's so important to pause, ask questions, and make sure every test fits your health needs. Not just a checklist or protocol. You have every right to speak up. To ask, "Is this really essential?" To say, "Can we explore a safer alternative?" Because informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. And here, we believe every choice should be guided by knowledge, not fear or habit. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video helped you feel a little more aware, more in control, or just more curious,